Hello, everyone, and welcome to our third session of the NSF-funded AEESP, Association of Environmental Engineers and Science Professors, Converging COVID-19 Conference on Environment, Health, and Equity. So this is session 3. The theme is on COVID-19 and the creation of efficient, healthy, and resilient cities. We have another amazing panel for you today. A disclaimer, this webinar will be recorded. By continuing to view this webinar, you are consenting to being recorded. We'll now show a short video of the conference theme.
The Association of Environmental Engineering and Science Professors, AEESP, is made up of professors in academic programs throughout the world who provide education in the sciences and technologies of environmental protection.
As hard as we work in our domain expertise, we need to work equally as hard to build positive human relationships with our colleagues, our students, and the communities that we serve.
We will continue to work towards a more just, equitable, and healthy society.
The goal of the virtual conference, Converging COVID-19, Environment, Health, and Equity, is to bring together different disciplines of environmental engineering and science to discuss actions to form a more healthy, just, and equitable society.
The conference themes align with the National Academy of Science, Engineering, and Medicine's grand challenges for environmental engineering in the 21st century. And they are
COVID-19, systemic biases, and environmental engineering and education.
COVID-19, fostering informed decisions and actions.
COVID-19 and the creation of efficient, healthy, and resilient cities.
COVID-19 and sustainably supplying food, water, and energy.
COVID-19 and designing a future without pollution and waste.
COVID-19 and climate change mitigation and adaptation.
Each session, as much as possible, will look at the convergence of air,
Water,
wastewater,
Food,
People, the built environment,
waste, fostered by the COVID-19 pandemic, and the unfolding realities of the need to address inequities in our communities.
faculty from the University of South Florida and the University of California, Merced, are pleased to hold this virtual conference with support from AESP and the National Science Foundation's CBET program.
At this time, I'd like to introduce our moderator, Dr. Catherine Alfredo. She's an assistant professor in civil and environmental engineering at the University of South Florida. Dr. Alfredo's research interests include drinking water quality and treatment, sustainable potable water provisions, U.S. and international water quality regulation, and community support of drinking water technology. Dr. Alfredo earned her PhD in civil engineering at the University of Texas. She's served multiple Fulbrights, one in Ghana in 2008 to 2009, as well as the Fulbright Nehru Postdoctoral Fellowship in India in 2016 to 2017. She was a postdoctoral researcher at Columbia University Earth Institute and a researcher at the DC Water. Join me in welcoming our moderator, Dr. Catherine Alfredo.
Thank you, Colleen. So the theme of today's session is from the National Academy of Sciences, Engineering, and Medicine's Environmental Engineering Grand Challenge of creating efficient, healthy, and resilient cities. The 21st century will exert pressure on our cities, both existing and future cities, like we have not experienced before. The United Nations predicts that the world's population will reach 9.8 billion people by 2050. That's a 30% increase from today. At least 2/3 of that population, or 66% of that 2050 population, is expected to live in cities, increasing the pressures on our urban systems. The provisions of clean water, food, energy, and sanitation will become ever-increasing challenges. Today's cities already face widespread challenges. Occupying only 3% of the ice-free landmass on Earth, cities are responsible for the majority of waste and greenhouse gas emissions globally, as well as the majority of total natural resource consumption. Inequalities, urban sprawl, access to open space, quality of life are all challenges to our present-day city. As cities become more densely packed, especially in low and middle income locations with large, densely packed informal settlements, increased human contact with domestic and wild animals in turn increases the risk of disease transfer with pandemic consequences. Before our current surreal situation with COVID-19 pandemic, the SARS epidemic affected 26 countries in 2003, spreading to over 8,000 infections. Obviously today, we would easily trade realities to have only 8,000 infections. Our current COVID-19 pandemic has over 45 million infections and over 1.1 million deaths worldwide. In the US alone, over 9 million people have been infected. But the world's cities are not only at risk for rapidly transmitting the next disease outbreak. The stability of many cities are at risk from threats of extreme events, floods, heat waves, droughts, all of which are expected to become more frequent in the near future. But there is hope. Cities offer opportunities. As infrastructure within cities age, we have the opportunity to reimagine and redesign aspects to support multiple functions. It is possible to create more equitable, efficient, healthy, and resilient cities. To create healthy cities that promote a high quality of life for all their residents, all of them, we will need to ensure a city infrastructure and design accounts for clean air, safe drinking water, efficient sanitation, affordable transportation, reliable access to power, health services, and access to nutritious food. Resilient cities will be able to endure disasters, environmental, economic, terrorist-driven, to withstand these stressors and recover. Designing for resiliency against climate-driven stressors is needed to sustain cities and support their current and future populations. To withstand the predicted population pressures, city design must be revised. The present may look grim, and the future predictions by the numbers may seem grim. But as environmental engineers, we can create a more helpful future, a more hopeful future. Ecologically conscious design, prioritizing conservation over treatment, investing in smart technologies, the future is ours to imagine. Today, we will hear talks on sustainable urban infrastructure systems, infrastructure development, research on assessing and improving indoor air and environmental quality, water quality concerns in our built environments, and exposure health risks and considerations. I'll introduce each of the presenters prior to their 5-minute mini talks. After the presentations, we will hopefully have a lively discussion regarding how we create efficient, healthy, and resilient cities now, in an immediate post-COVID world, and into the future. Our first speaker is Dr. Shelley Miller. Dr. Shelley Miller is a professor of mechanical engineering at the University of Colorado Boulder and a faculty member of the interdisciplinary environmental engineering program at CU. Her research interests lie in indoor air quality, urban air pollution, health effects, air pollution mitigation, and many more. Dr. Miller received her BS in Applied Mathematics from Harvey Mudd College and MS and PhD degrees in Civil and Environmental Engineering from the University of California, Berkeley. Dr. Miller has been a key contributor to understanding and managing COVID-19. Welcome, Dr. Miller.
Thank you for the invitation. It's great to be here. I'd like to touch briefly on how to ensure air you're breathing in your indoor environments is safe. Next slide. So let's start with a framework, and I'm going to talk more generally about indoor air in buildings, and then I'll focus on what we're doing specifically for COVID recommendations. But in an indoor environment, you have sources of pollutants. These are emissions from indoor sources, and people themselves are also sources. You also have outdoor air pollution coming into your indoor environment. What happens in the indoor environment is like a mini reactor, in that you have deposition of chemicals and constituents that are causing some health effects possibly. You have ventilation to dilute the concentration in the air, and you can add air cleaning to your environment to supplement your ventilation to reduce the exposure to contaminants even further. In this diagram, I show that we have surface deposition of virus containing particles. They also can be inactivated just because they can't live that long in a drop and being airborne, and that you can clean the air. Next slide. But I don't want to forget all the other sources that we typically worry about when we're not in a pandemic, which is traffic-related air pollution that can come into your home. Next slide. And also things that you do in your house. When you clean your house, when you vacuum your carpets, when you cook, you generate a lot of air pollution in your space. When you use personal care products, you can also add contaminants to your space. And building materials and furniture also add contaminants to your space. So being concerned with removing the sources and paying attention to the losses can help make your indoor environment healthier. Next slide. I'd like to focus on source control first, because in the indoor environment, we really do need to focus on removing the source of the pollution first. So for example, if you're cooking, you would turn on the hood over your stove. Or if you don't have a hood, you would open a window, and that could help reduce the emissions that are coming right from the source, which is cooking. In the context of COVID, we recommend source control being masks, which has a diagram on the left showing how the masks filter out airborne particles containing virus, and data on the right showing that with a mask, both larger particles and smaller particles are efficiently removed using a mask. And next slide. And then as another method of source control, we do recommend distancing. And this is also true for other pollutants, even things like cigarette smoke. The farther you are away from a smoker, the less contamination you will breathe until it completely mixes into your indoor environment. Once it does mix into your indoor environment, we have other approaches to reduce exposure. Next slide. And the things that we use first are called ventilation. We ventilate our homes either by opening our windows or doors, or we use a mechanical ventilation. The diagram on the right shows what the future should hold for home ventilation, meaning we do it in an energy efficient way, and we bring in good clean air that can be filtered. On the left is a graphic from an article I wrote trying to explain about mechanical ventilation, especially in a classroom, where you provide a certain amount of outside air per person, and that can also then provide you with an understanding of how rapidly the indoor space will be cleaned through the air changes per hour parameter. Next slide. But to supplement your ventilation, if you do not have enough ventilation, and right now we're very excited that the WHO has released a video today that I will put in the slide after my talk, recommending 6 air changes per hour in indoor spaces to reduce the risk of COVID transmission. If you can't get 6 air changes per hour, you add air cleaning with an air cleaner that must be sized to the space that you're in, where you turn it on and it can clean the particles out of the space. We've developed a tool that you can use to size your air cleaner, and I want to recommend that you try to purchase an air cleaner that is certified. Next slide. And in certain environments like healthcare facilities and also homeless shelters and jails, and we're even looking at this technology for restaurants, we would add a different kind of air cleaning approach, especially for larger environments. We would use something called germicidal ultraviolet irradiation. And what's cool about the technology is we use UV also to disinfect water. And here we're using it to disinfect air, where we hang lamps in the upper part of your room, and on the graph in the lower left, I can show in some studies we did for the CDC that as you increase your radiation in your space, you increase the equivalent air change rate. So we were able to get 17 air changes per hour using 5 germicidal lamps, such as the one pictured on the right. Next slide. And I think that that's all I'm going to share with you today, except I want to note that the layered approach for protecting yourself against the respiratory virus, SARS-CoV-2, and also, in general, any infectious disease, does include source control, physical distancing and masks, and also room control, which is increasing your ventilation, as well as the other important aspects of public health. So thanks for this time, and happy to answer any questions.
Thank you, Dr. Miller. Our next speaker today is Dr. Andrew Welton. Dr. Welton is an associate professor of civil engineering and environmental and ecological engineering at Purdue University. His team investigates and solves problems that affect our natural and built environments. His expertise focuses on environmental chemistry and engineering, disasters, water quality, infrastructure, and public health. Dr. Welton holds a BS, MS, and PhD degrees in civil and environmental engineering from Virginia Tech. Dr. Welton has contributed to the discussions of COVID-19 related building closures and the impacts on our distributed potable water quality. Welcome, Dr. Welton.
Thank you. Thank you for having me. So I was asked to share some insights about water safety and how we can know if the water that we're using in shut down buildings or buildings that have gone to low occupancy is safe. And that was a really challenging question that kind of precipitated early on in the pandemic as a lot of social and physical distancing occurred. Next slide, please. And so just to kind of set the framework here, many of us work and live in buildings, and we work in homes, we work in big commercial buildings or multi-use buildings that maybe have multiple floors. There may be multiple tenants in a building, or you might have a doctor's office, some apartments, a dentist's office, and a restaurant. And the complexity there is that each of those building users uses water differently. So they may have different pipes, they may have different needs for hot water, different lengths of time when they're using the water. You know, during the day, the restaurant would be using the water, whereas maybe at home, you wouldn't be using as much water. And in this challenges water safety at the faucet, because that means that the water may age differently inside the building, in different parts of the building. And much of this water is in the US delivered by what's called public water systems. So these are regulated entities that either get the source water, they treat that water, or they just simply distribute it to their population through buried pipes and tanks and the like. And so when the COVID pandemic hit, many questions came up about, well, how do we know that if you leave a school stagnant, where the water's not moving at all, for 5 months and you go back, that it's safe for kids and adults to be exposed to? And so that led us to question the science, state of science about heavy metals and pathogens in the water, which are primarily the risks that we're concerned about. Next slide, please. But, you know, the COVID pandemic, and even before the COVID pandemic, we were concerned about building water safety from a disaster perspective. So we're all familiar with the wildfires that are happening out in the American West right now. Many of the buildings that are left standing sometimes have contaminated water being delivered to them because the water distribution system, the hydrants, the tanks, the valves, the meters have been contaminated. And one of the questions that is afflicting these communities now is, how do you know how to determine if building water is safe? And where do you sample? How do you sample? What do you look for? When's enough? And you're seeing different states take different actions. Recently, the state of Oregon has done some great work where they've kind of upgraded some of the failures of a policy that was developed after the Camp Fire in California and addressed some of the nuances with sampling water. Now, why that matters is, next slide, please. After the COVID pandemic struck, and a lot of questions came up about building water safety, there were a number of different federal agencies, state agencies, nonprofit organizations, companies, consulting companies, generating their own guidance on how to make building water systems safe. Some of them were, all of them I think were well-intentioned, but many of them were detached from reality, detached from science and the state of the science. And so, you know, where we are, why did we do that? Why did we see that? Because there's a disconnect between the data and the evidence and the people that implement policy. And so that's one of the challenges that we're seeing here. We really need to take an approach, which is exciting, to make transformative change with regards to advancing public health. We need to have science and engineering. We need to have policy, adoption, and buy-in, and it definitely has to be driven by and supported by the community. Next slide. And so, together, what we have done is we've worked with a number of different institutions after disasters or during, in response to this pandemic, and helped generate documents that pertain to the state of the science about building water safety and some of the health risks that we're concerned about with regards to stagnation. And then the American Water Works Association published a how-to guide on how to basically evaluate building water safety. And so with that, I'd like to say thank you very much for the opportunity to be here. And we really need a whole bunch of disciplines to participate and help us kind of advance public health forward.
Thank you, Dr. Walton. Our next speaker is Dr. Paloma Beamer. Dr. Beamer is an associate professor in the College of Public Health at the University of Arizona and is currently the president of the International Society of Exposure Science. Her research focuses on understanding how individuals are exposed to environmental contaminants and the health risks of these exposures, with a special focus on vulnerable populations. Dr. Beamer earned her BS from the University of California, Berkeley, and her MS and PhD from Stanford University. Dr. Beamer has considerably contributed to the current discussions regarding COVID-19 exposure. Welcome, Dr. Beamer.
Good morning. It's still morning here. Thank you for having me. I am an environmental engineer by training, so it's always nice to get to come back to my roots. And as the president of the International Society of Exposure Science, I often get asked, what is an exposure scientist? And no more than this year have I been asked that. And it's, we often get confused with our close colleagues in epidemiology, and epidemiologists study the association between exposure and disease. And exposure scientists, we feel like we study the relationship between the source of things in our environment and how they get to the person, how people are exposed. And that ties into aerosols, to water, to everything we do, all the media that have been discussed already today. But what we really focus on that I think is different is the people and their behaviors and how they interact with those media. And by studying that, we can think about how to prevent exposures or reduce exposures and control them by thinking about the ultimate person that we're trying to protect. One of the things that has come up a lot as we're working through the pandemic in our field is that everybody's trying to figure out how to do everyday activities in a new way to keep themselves and their families and their loved ones safe. So one of the things that I've been doing a lot is speaking to the public, speaking to colleagues about various different types of activities and helping them break down their work, how to do their work safely, but also how to do things like going to the grocery store safely. So what I was asked to talk about today was how to take the principles that I've taught in my classes for years and years and apply them to your everyday activities and how we can all use them to communicate with the public about how to stay safe during these times as we move forward and get used to our new normal. Next slide, please. So really my goals in these talks that I've been doing, and I should have mentioned yesterday, I gave a talk here on campus because we are trying to come up with a way to allow students to have some more events because we know they need it for their mental health. And we're hoping that if we work with them to do the events safely, it'll prevent other events being done that perhaps aren't being done safely. So the goals in all of this is to give people agency on how to protect themselves, to have the knowledge to protect themselves and their loved ones. And the general steps I take when I talk to people about these sorts of things is first to break down the primary exposure concerns. And then we go into explaining what is called the hierarchy of controls, something that comes out of the field of occupational health. And finally, working with them and applying it to their scenario. I've worked with schools locally. I've worked with some of our local bike mechanic shops, even summer camps. So lots of different scenarios. Next slide, please. So I think we are familiar already with what the primary exposure concerns are, and I think they've been highlighted along the way. And I guess I didn't include water here because that would be a whole different thing to consider. But right now, when we're thinking about how to protect ourselves, the first thing we want to think about is what is the source? And I think that's one of the things that makes this pandemic so hard is the source are infected people, many of whom are asymptomatic, especially like here on a college campus. that they don't know that they have been infected. And even symptomatic people are most contagious a few days before they develop the symptoms. That's one of the things that's so unique about this virus compared to previous SARS or to the flu, is that you're actually shedding the most virus before you even know that you're infected. And these infectious people are releasing virus, through close contact and close proximity, but it's also airborne, as we all keep, working on emphasizing in our field. And then once it's in the air, or even from surface contact, it could end up on fomites or other surfaces in your environment. And then we're all trying to protect that susceptible person there on the right. And so as it goes from the infected person to the susceptible person, it's traveling along these different, what we would call exposure pathways. So when we think about control, we want to think about the source, the path, and the person. Next slide, please. Oops, okay. So the hierarchy of controls is actually written into the OSHA code. People don't realize that it's been there for a very long time. It's used a lot in occupational health by both OSHA and NIOSH. And really, it ranks controls from the most effective to the least effective. And they're ranked because the most effective controls, the ones that will help us stop the transmission of the virus earlier, are those that are at the source. And these include elimination. That's why we're all working from home. We're trying to reduce interactions. Substitution, we can't substitute coronavirus. We can't wave a magic wand, but we can substitute the way we do things virtually. Can we do something outdoors versus indoors? Engineering controls, this is where ventilation comes in and why it's so key and such an important step along the way. Same with barriers that we have, like the sneeze guards we have in the grocery stores. And then how we do things, changing the way we do things, physical distancing, washing our hands, all of those are what we would consider administrative controls. And then the least effective, not saying that they're not important, but they're the least effective is protecting at the source, at the infected person. So this would be wearing like an N95 respirator. If you can't control any of these things above you, you might consider wearing personal protective equipment, but that's the least effective. Next slide, please. Oops, can we go back? So I think one of the things that didn't get translated on my slide is I had put face masks overlaid, and I guess it got dropped, but face masks are not personal protective equipment. They're what we've been calling in our field community protective equipment. And that I would actually rank somewhere between the green and the yellow areas, because it's stopping the source as close as possible to the source. By wearing face masks over our face, if we were potentially infected, we're stopping it really quickly. Next slide, please. So I'll move through this really quickly. We applied this early on in the pandemic to flying, airplane travel. Next slide. Oh, there's the face masks. It's on that one. But if we were to walk through applying it to the airplane travel, I mean, you want to think through it really quickly. You would say, can you eliminate the trip? Can you substitute how you get there? Could you drive? Different airlines are doing things differently. Which seat is best? Window seats, actually, because you can minimize the number of people near you. Look at the engineering controls on different airlines. And then you can take controls yourself, right, by practicing good hand hygiene, bringing stuff along to wipe down surfaces, plastic bags to put your ID and stuff in. And worst case scenario, you could also consider wearing, a PPE, like an N95, obviously one with no valve, right, so that that's not creating a chimney, and potentially a face shield. So this is how I would break down a regular common activity to somebody. Next slide. So these are just a review of the steps I was mentioning, and you could apply these to any scenario. Next slide. And so I know tomorrow's Halloween, and we're all struggling with how to do things safely with our children. And so hopefully you consider some of these as you work through that with your family. And I will go ahead and end now. Thank you.
Thank you, Dr. Beamer. Our next speaker is Dr. Anu Ramaswamy. Dr. Ramaswamy is a professor of civil and environmental engineering at the Princeton Institute for International and Regional Studies and the High Plains Environmental Institute. Dr. Ramaswamy is an interdisciplinary environmental engineer recognized as a pioneer and leader on the topic of sustainable urban infrastructure systems. Dr. Ramaswamy received her PhD and MS degrees in civil engineering and engineering from Carnegie Mellon University and a BS in chemical engineering at IIT Madras. Welcome, Dr. Ramaswamy.
Thank you. Thanks for having me here, and I'm going to be talking about research and education relating to social equity in sustainable urban infrastructure systems. And I want to acknowledge and thank our project supported by the US National Science Foundation. This is the Sustainable Healthy Cities Research Network. And the next slide shows you that our network includes city policymakers. Since 2007, you can see in this picture, we've been collaborating with cities. And the interest from cities in infrastructure and social equity comes from many dimensions. Cities are increasingly looking at equity across multiple agendas: carbon mitigation, regional transportation planning with new technologies, food action planning, and of course now COVID, adaptation to COVID. And urban systems are where people, infrastructure, and the environment intersect. And there's extremely high levels of inequality, both in determinants as well as in outcomes, health and well-being. And so far, most of the work has been done in sectors. And the goal of our project was to bring multiple sectors together with multiple stakeholders, and in a very interdisciplinary way, which is the heart of convergence. And you see all of our partners here from several cities in our workshops. The next slide shows the framework we co-developed with cities. And here you can see the 7 essential provisioning systems: energy, buildings, mobility, connectivity, food, water, sanitation, and waste management, and public spaces. These physical systems interact, next click. These physical systems interact with social provisionings, primarily, of course, healthcare, but also education, all of which have been impacted in this pandemic. And these together shape final societal outcomes. Several clicks. So the first one, of course, is environment and sustainability, human health and well-being, economy and security. And our group is studying equity, the next click, as inequality and fairness, both in the determinants and in the outcomes. And we call these the final societal outcomes that we're working with cities. Next click, please. We're working with cities on tracking long-term. And so we want to be conscious about long-term outcomes tracking with cities versus what engineers study. Next click, please, which is features of a place. So we can say what makes a place resilient, and we have all these latent features of places, what makes it livable, what makes it resource efficient, but keeping our eye on the ball that we really want to figure out what cities should be tracking human data, what types of human data would you be tracking long-term. So this has resulted, next slide, in a lot of really interesting projects across our network, which has 8 universities. And the projects are all co-developed with our community partners who've helped us with data. And at the core, we have a data framework. We have an interdisciplinary data framework, which you see over here. And we can just go through several clicks in sequence, and you can see work on access, work on consumption, keep going, work on inequality in spatial patterns of energy use, air pollution and health in Atlanta. Next slide. Well-being, we're actually measuring well-being. What does well-being mean? How do you measure it? How do you look at inequality in it? And co-producing metrics so that utilities can use them to shape investments. The next slides just give you a quick example. We're working, for example, we've characterized inequality in Indian cities. These are data from 10 Indian cities on floor area, electricity use, LPG, and you can actually see factor of 3 to 10 differences between the highest income and the lowest income households in several of these cities. And tracking multiple cities allows you then to figure out theories. Why are some cities more or less equal? The next click shows you work we've recently done with a very nice data set on energy use, looking at intra-urban inequality. And the bottom line is that through fine-scale data, we're finding inequality by income and race much higher than what was previously understood. Because we just didn't have the data, I guess the partnerships with utilities really help us get fine-scale data. And the next few slides, really, we can just go through them. We're working on food action planning. The next slide shows, again, data are not available. We move to the next slide. We actually developed new approaches to address food insecurity. So you see here long lines for food insecurity. We're working to find out how much backyard and community gardening can actually help food insecurity, which in fact causes obesity and other comorbidities with COVID. And then the very last slide shows that we're developing new approaches to tag household gardens. You're seeing a lot of inequality by income that you can see in the graph. And we've actually seen almost a doubling of gardening between 2017 summer and 2020. So just click, and then the last slide is just thanking our network if you click on the next slide. So thank you and welcome questions during discussion.
Thank you, Dr. Ramaswamy. And that's a great reminder. Before I introduce our next speaker, I want to remind everyone in the audience that the question and answer function is open. Please type your questions there at any point, as we are constantly compiling them for the panel discussion. Our final speaker is Mr. Anthony Kane. Mr. Anthony Kane is a president and CEO at Institute for Sustainable Infrastructure, or ISI. Mr. Kane has been instrumental in the creation, launch, and growth of ISI's Envision program, a framework that supports higher performance through more sustainable choices in infrastructure development. Prior to ISI, Mr. Kane was a research director at the Zafnas Program for Sustainable Infrastructure at Harvard University's Graduate School of Design. He received his master's in design studies from Harvard University. Welcome, Mr. Kane.
Thank you very much, and thanks for having me. I'm just going to speak for a few minutes on how hopefully COVID-19 and its impacts will drive a fundamental shift in how we conceptualize our infrastructure systems for the sustainable cities of the future. We know from resilience theory that we have shocks and stressors, and that the stressors are these underlying strains on our systems that then exacerbate the impacts of the shocks. And COVID-19 is a shock. It's a shock to almost all of our systems. And so what we've seen is, while we have been aware of the inequity in infrastructure development, especially in this country, COVID-19 has put that into stark relief. And we've also gained a nuanced understanding. So while we've also been aware for decades of the chronic underfunding of our infrastructure systems, now we see a more nuanced view of how that underfunding is unevenly distributed in an inequitable way, and how certain communities are feeling the impacts more because of that underfunding. Just if you think about the communities that are more dependent on public transportation and how they're impacted due to this health crisis, families that are now entirely dependent on data and telecommunications infrastructure, and how they're impacted by underfunding in those areas or being underserved. So we're seeing now in stark contrast, and then layering on top of that a new appreciation for our impact as human beings on the environment, the increasing impacts of climate change. All of these things now are sort of converging. And it's not that we weren't aware of them before, but we're seeing them in a new way, and we're seeing how impactful they are. And that's important because I think, especially when you latch onto the title of this conference, it's not for the future when we think about sustainability, how do we design healthy cities, or how do we design efficient cities? It's how do we design cities that are healthy, that are efficient, that are equitable, that and so on and so on. It's going to involve a complex multivariable equation of how do we solve that. And unfortunately, many of our systems are not designed to solve problems that way. Even when you think of our governance systems, our funding systems, our education systems, we are taught to solve problems in a somewhat linear way, in a siloed way. And we need to break out of that in order to address the problems and the challenges of the future. So there, I think the important point is, while we need to be focused on equitable outcomes in our infrastructure delivery, we also need to be focused on equity within the infrastructure delivery process itself. So how do we get a diversity of perspectives, a diversity of people together? How do we recognize that innovation is going to require doing things differently? Doing things differently is going to require bringing new people to the table. And that's a diversity of backgrounds, of skill sets, of perspectives, of personal backgrounds and experiences. It's going to be incredibly important. We cannot hope to imagine a new way of operating by just bringing the same ideas that we've had in the past. There's a great Professor Amy Edmondson from the Harvard University Business School who studies teams and how teams solve problems. And the studies find that homogeneous teams will solve problems faster, but diverse teams will solve problems better. And that's what we need, diverse teams that come up with better solutions to the challenges that we're facing. The work we do with the Envision Sustainable Infrastructure Framework, as was mentioned in the introduction, with that, we hope to provide this ability to convene people, a common language for which these diverse people can communicate, and a prompt to start those conversations. We know that if we want to enact change, the first step is to open a dialogue. And again, by having these opportunities and driving that dialogue, we can take the first step towards changing people, changing our systems, changing the way we deliver our infrastructure. And we think that's the first step. So that's really just sort of a challenge, and I'm happy to continue the conversation in the questions and answers. Thank you.
Thank you, Mr. Kane. So thank you to everyone for a great informative presentation. I invite all of our speakers to turn on your videos. Before I open up the questions to questions from the audience, I have a few questions I would like to ask our panelists to start the discussion. That was my timer. My first question is to everyone. What role does equity play in your research and teaching? And how do you incorporate equity into your research and teaching? And just for everyone in the audience and that we're all on the same page, equality refers to giving everyone the exact same resources, treating everyone equally, whereas equity refers to distributing resources based on the needs of the recipients, or proportional representation distribution. So again, what role does equity play in your research and teaching, and how do you incorporate equity in your research and teaching?
This is Anu. Maybe I can just begin by saying what I presented was a research framework that does exactly that. It integrates equity foundationally across multiple sectors, social determinants, and multiple outcomes. And it was actually stimulated by cities asking us for that. And in our Convergent National Science Foundation project, it's a fundamental part of our research. And what has been interesting is connecting the dots across multiple outcomes and the 7 sectors.
If I could just add on to that, what I have been doing is trying to focus my efforts in communities of most need. So some of the Latinx communities around Denver, or the lower income communities. But what I find really important is to partner with community members, and also somebody that's a scientist that actually looks more like the community than I do, because they understand from a personal point of view and from an experiential point of view just how to actually do the research in a more equitable and way that I would then like to support and work with.
One thing on our end, we work a lot with engineers, and engineering is a technical profession and is often thought of as problem solving in a very technical way. So what we see often is the highly specialized disciplines think of what they're doing, and they don't always see the big picture of how it's really about people. All infrastructure is about people. So that's a big part of what we do as well, is to not divorce the technical solutions from the people that are being served, but rather to help clarify that everything that we are doing is ultimately benefiting a community, and how do we talk about it in those terms versus a 52-inch mainline pipe that's going to provide so many cubic feet of water, right? How many people is that going to serve, and how many neighborhoods are we going to protect? So that's just one small piece of what we do.
Great, thank you. Go ahead.
I'm in on that too. So I'm part of why I switched from engineering to public health was the mission of the college that I work for. Our mission is to achieve health equity in the Southwest and globally. And so it ties into every part of my research and teaching. And from my research, it's just like Shelley said, I work a lot with communities. I work with a lot of community groups, and then we answer questions that are important to them. And that's first and foremost. With our teaching, we are a Hispanic serving institution and a Native American serving institution. So our students are from all over, but we work with a lot of underrepresented students, but we get them involved in our research projects. In the last couple of years, we've had almost 200 students work with us. And so it's really important to get them back into their communities. And then finally, for those of us that speak multiple languages, it's really important to do these kinds of talks in those languages. So I've been doing some Facebook Lives in Spanish, and some of those have had over 400 participants on them, even if they were like on a Saturday afternoon, and a lot of them, the public, lay people that just are dying for this kind of information in other languages.
That's a great point. And I think that's something that we haven't seen very much is this kind of conversation in multiple languages, especially in the United States. So my second question to everyone is related to the theme of convergence and the others on this panel. After hearing their presentations, how can we make our research more convergent? And Dr. Wilson, I'd like to ask you to start, since I know you spoke a lot about the needs of integrating public policy and engineering. And so after hearing everyone else speak about similar issues, how do you believe we can make our research more convergent?
So I did my homework and I listened to the other AESP COVID presentations, and I kept hearing a refrain from different faculty, get out of your office, go across campus, go across town, start talking to other disciplines and people that you generally wouldn't talk to in your pipeline of civil environmental engineering or just engineering. I think we need to do that more. And I think by demonstrating through example, engineers advancing public health, making those connections is really important. Communications are critical. It doesn't matter if you have the science if your communications are terrible. It doesn't matter if you have the science if the policy makers and adopters don't care for it or can't understand it because it's just too complex. So I think we need to become better at transferring the knowledge that we generate and then implementing it into practice.
That's really interesting, because I feel like that's what we hear a lot is go across campus, talk with someone else, but then, on a professional level and just talking in the academic circles, then trying to get that research out and funded and published and advancing your career on that kind of platform is not always the easiest. So in light of the discussions that we had, do we see this convergence or this getting across campus as the new mantra within our fields or within environmental engineering and academia? Or are we just saying it but aren't really going to actually take it on?
I think the students that we serve and our communities are demanding it. I unfortunately think higher education is so hard to push it in the direction that we all want it to go, that I still think that faculty are not rewarded for this kind of work at all, calling it service, having difficulty getting promotion and tenure. Unfortunately, that's actually been my experience at my institution. And so, we need to keep pushing from faculty, staff, students, and communities to make this a reality.
I might add a little bit from the work I've done with students through multiple NSF grants. So the first thing I want to say is that the fact that donors and grantees, grant funding organizations are emphasizing convergence, interdisciplinary and problem-focused research is a big step because it helps push change in our institutions I do agree students are another big push. And I just wanted to say where my students have found employment and where they're thriving. There's a lot of opportunity for engineers to innovate through entrepreneurship. My first group of 5 PhD students started their own company called Symbiotic Engineering, which was then working with cities on infrastructure. The second is I always encourage students to go join these working groups. Many cities have working groups focused on equity, where they can meet community members that are in different professions, members from underserved communities. They can serve on food policy councils. So they really get to know. You don't have to go to faraway countries. We have all of this with projects where we take students abroad. You can do this right here. And then, you co-develop projects. So I see a lot of opportunity. A lot of time is also needed to co-produce. So my students and I have co-produced food action plans, climate action plans, but that takes, 2 years, 2.5 years. And so having PhD students work with undergraduate students sort of creates a network of students that can be continuously engaged with the cities to their own professional benefit, because all of them have had jobs relating to those experiences.
I think that's a great recommendation and something that I will definitely pass on to my students, is getting involved in local community groups. I'd like to now open it up from questions from the audience. Dr. Naughton, Dr. Trotz, do we have any submitted questions?
Yeah, this is Colleen Naughton. One question from Jesus is, as COVID-19 cases spike once again throughout the US and possibility of stay-at-home orders arise, such as Denver, so for maybe Shelley Miller, could household transmission significantly add to COVID-19 cases, and what are some ways to mitigate this?
Yeah, I think right now the rise in cases is due to mostly a household transmission. Unfortunately, houses have very low ventilation rates, and they're really quite tight, and they're probably a half an air change per hour or less. People don't realize it. So in order to minimize in-home transmission, you need to keep occupancy low. If you're having visitors, have them come over for shorter durations of time. Make sure you open a window, make sure you're distancing. And I think that this is really something people need to be paying attention to in their homes.
Can I chime in on that?
Yes.
So I think one of the things we need to also consider is that not everybody has as easy ability to reduce household transmissions, and some households, particularly in our most impacted communities here in Arizona, at least, have household crowding. And so we really need to think about that. Also with our college students, many of them are living in multi-generational houses. So the decisions of the university are impacting this household transmission in a lot of ways. But we've been working really hard to emphasize reducing the number of visitors, being outdoors as much as possible, really scrupulous hand hygiene, using those Lysol wipes if you can find them. It took me months to find them. I was begging people to send them to me. But even just once a day, if you wipe all the surfaces down in your home once a day, if you have everybody washing their hands more frequently, especially with our children, getting them into the habit before they go back to school if they're not in school already, it's really important to work on all those practices.
Okay. I'll pull another question. I finally was able to open up our questions. So I'll pull another question from our audience. This one we got from Twitter from Fernando. How can we help increase resilience within tribal and/or rural communities?
So sorry to jump in, but I'm on a grant with some of my tribal partners, and we are working with the Navajo Nation. And this is one of the things that's been the most complicated, because you think about engineering solutions, and one of my closest colleagues is Carletta Chief, who's actually an environmental engineer from the Navajo Nation. But in these communities, they don't have piped water, right, to wash their hands with, and they have to go get water and haul the water, and that increases transmission because people are interacting at these hauling water sources. And so we really need to think about what can we do in these communities to increase access to water, increase access to the things that are needed so that they can reduce that transmission, but also still give them sovereignty on the data from the COVID, on access to their own data and to analyzing the data about their current risk factors. Some of it's associated with water, some of it's associated with some of the comorbidities that Anu talked about. But also, there's a lot of vaccines being developed that are being targeted there for testing. We need to think about how to do that equitably to support them, but also in a way that gives them control.
That's great. Our next question is, on the topic of the creation of efficient, healthy, and resilient cities, what are some of your immediate responses to people who refuse to listen to or follow the guidelines that are purposefully set to protect their communities? An easy one.
So I'd like to just jump in real quick. There are no guidelines really for drinking water safety in buildings. And so much of it is different perspectives. I know CDC came out with a guidance document that they posted online, but it's not actionable because it's too general. And so, so when it comes to water, everybody's still kind of on their own, hiring consultants if they have the money. If they don't, then they're just kind of doing some things and hoping that it works out. So that's water.
I might just briefly add, I think it's more frustrating right now because the consequences are so dire, but it is a challenge that we actually face all the time, right? In everything that we do, part of our job as professionals is to communicate with the public. It's more challenging nowadays because all of our infrastructure systems are really too complicated for an average layperson to really understand how our energy systems work, how our water systems work. So I think it's something maybe in our education and our professional development on growing those communication skills. Like I mentioned, making it about people, making it about the community, identifying the pieces of information that are key, not trying to explain to someone how, energy transmission lines work, but, how is this going to impact them? So I think that's just a capacity building thing as professionals that we need to kind of put in our toolbox, is to be better communicators.
I'd just add to that a lot of outreach is happening. Engineers aren't the only people who are running communities and cities. And that's why I think it's so important to actually formally partner or informally with communities, because then they have their networks. So many cities have processes through which they do planning, they do community development. And so I think broader partnerships, we don't have to do all the communications, but thinking through, how we can support other groups that are already doing this. And the challenge is big because it gets down to what people believe. And, that's a realm, at least I'm not trained to convince people one way or the other what they believe in. But I think those conversations happen in other forums. This is why the interdisciplinary part of convergence is so important. And so cities and other offices, community-facing grassroots organizations, those would be where you actually do communication.
So to kind of build on that, so Dr. Miller, you mentioned in your talk, and there are some questions kind of related to this that we see in the Q&A box, but you mentioned, some things about, you had that image of the building that is the future with the diagram of air exchange. You mentioned that the WHO came up with this new guideline of 6 air exchanges per hour, I believe you said. And I just want to know, what will it take to get there? So this is where we should be going in the future. What will it take to get there? And what will it take to get there equitably?
Yeah, I think it's a big, heavy lift. I think it's a dedicated effort by community members, professionals and organizations who provide guidelines on these kinds of questions to continue to demand for better ventilation and better building construction and design, where we allow for natural ventilation, we allow for energy efficient filtered air to come into some buildings, we allow for some buildings that are tighter so that we reduce energy use by heating and cooling. It's expensive. It takes a lot of design know-how, and I think we need the future. There's a future for engineers to continue to push this agenda, and that's a very important thing to address both climate change and health. I think we're pretty short-sighted. Once the pandemic goes away, people are going to be like, oh, well, I'm comfortable in my indoor environment. I don't need better ventilation. But you do. And so, it takes a big focus and a drive to make this happen, because it's a big lift.
And do you think that it goes beyond just investing? Because that's a huge part too. We also have to strategically and ultimately invest in it as a population. And so even just beyond that, it goes towards innovation and redesigning, from hearing you.
We need innovation, we need redesigning, we need people to take a look at how we can make healthier buildings, and we need people to understand how indoor environments are polluted, with better materials. Why are we treating our furniture with flame retardants? Why are we putting toxic chemicals in our detergents? As long as we can try to minimize the toxic chemicals we bring into our environment and innovate and design how we can improve the building shell and the ventilation where we spend all of our time, I think that we would really it would be great to see a movement in that direction.
And I kind of want to open this up now to everyone, in the sense that, a lot of you presented this picture of the future. And what will it take for us to get there? What is the key thing missing, other than just straight innovation? Is there something else critical that we really need to think about as we try to plan these resilient, efficient, and healthier cities?
I would say leadership. It takes people to stand up collectively with a group of not even like-minded people, but a collaboration of individuals and organizations, industry, government, in a community, and make change and be that change. I think that's what it will take. There's a whole bunch of other information, but that's my theory.
I would echo that. In a way, it's the public awareness and motivation that has been lacking so much. And that's been possible in the past because it's easy for people to take the infrastructure systems for granted, right? Water comes out of the tap, energy comes out of the plug, and I don't need to think about it. My hope is that this shock will be a bit of a wake-up call. And as we mentioned, the convergence of all these lines, we're not only now much more aware of other people's health, our cities and their impact on our health, our infrastructure systems. We've seen when we were in lockdown how a few weeks without human activity changes the environment, the air quality. I'm hoping that those lessons stick with us. Although I think Professor Miller said, it might be that we sort of bounce back and revert to old habits. But at this point, I think the quarantine has been so long, I'm hoping that some of this has been ingrained and we'll see a change in public opinion.
So I just wanted to add too that I think the critical thing that's missing is the diversity in the voices at leadership, right? And at those critical decision-making points. And I think that's one of the things that we really need to see changing. And I think in engineering, that's long been seen as a need. If you look back at the amicus briefs from even 20 years ago, the key to innovation and the importance of increasing underrepresented voices. But now as we're starting to think about the future and everything that's going on, overturning structural racism has been a big other theme this year. And if we look at critical race theory, centering on the margins is key. So that's centering on the most marginalized populations at the center of our decision making. And if we're doing that right now with our air and our water and the COVID response and thinking about essential workers, things might be very different than the way things are playing out. in decisions made by leadership right now.
So just to kind of
follow up.
Oh, go ahead.
I wanted to follow up on that exact point that it's centering on the margins in multiple ways. So, it isn't as if the US infrastructure has been working so well, and so it's just that we haven't been hearing from those people who don't have already good transportation, good water, good access to green spaces. And I think COVID just made that really visible, how much inequality there is. But it isn't like it wasn't there before. It's just that it wasn't surfaced. People knew it, but so, saying that, well, everything was working well, it really wasn't, but we weren't paying attention to it. So it's both bringing people in, exactly like everyone has been saying, but also we don't have data. When we started looking at data on inequality, we found that, as I mentioned, data at the fine spatial scale is actually not available for you to actually understand what are inequalities by race. The census only provides income and racial data at census block scales once every 10 years. And so getting better data is also where we can contribute in addition to partnering with the most underserved.
And, just to kind of piggyback on that too, is those communities that are traditionally left out are also have been found to be the hardest ones to reach, are the ones that are consistently left behind in development globally, because they are the more difficult. They're not the ones with the easy fixes. And so it's a long road ahead, but from what you all are saying is that it is possible and we can get there. I'm going to call back to Dr. Trotz and Dr. Naughton to see if there are any questions that are coming in on other sources.
Yeah, thanks. There's a question from Hope that what are some specific measures we can take to ensure that more people, especially in disadvantaged communities, have access to green spaces, parks, green belts, public gardens, which are so important for mental and physical health in these times?
I can take a shot at that. One of the things we heard from cities is that many of them had been closing down parks and green spaces during COVID. And in fact, a lot of the studies said exactly this on well-being, that these areas contribute to well-being. And so I think going forward in some of the collaborative work we're doing, we would probably integrate this in guidance if we were to face another quote unquote shutdown. I think cities have learned that not to close these. The second thing is that they have, and in my group has also done this, looking at actually measuring well-being of people who do gardening in their backyard versus community gardens. So many cities have actually closed their community gardens because of fear of transmission. But I think ways of providing resources for backyard gardening can actually be really strong because it both improves well-being and health and the food insecurity that I was mentioning. So I think switching resources between what was previously a community garden focus to other types of gardening can also provide those types of multiple benefits.
And Catherine, I would just maybe to quickly jump back to something you said about communities that are difficult to engage with. It's important to remember that often it's difficult to engage with those communities because, one, we have failed in the past to develop relationships and good communication on our end. And then two, that we have not instilled faith in ourselves and in what we are doing. I mean, we had an example in Los Angeles where there was a development of a wetland stormwater park. But when the city said that this was going to be a stormwater treatment facility, right, they saw gray infrastructure, a plant. They thought this is the city again trying to have a detrimental impact on their neighborhood. And it took a lot for the city to overcome that initial impression and say, no, this is going to be a park. This is going to be a beautiful pond. It's going to be an amenity for you. But that's I just don't want to imply that in somehow it's the difficulty is on the end of the receiving end, right? The difficulty is because we have often not taken the time and the effort to develop that good communication.
No, definitely. And I think it even goes back to the fact that we're not communicating in multiple languages. We're not consulting with community experts before we present our plans to understand what the trigger points are, or what has been done historically in the past that might be distasteful to a community, even though that might not be what's being proposed. No, I absolutely agree. That's a great point. I would like to call back to Dr. Trotz, I believe, has a question from Barbados. I can't access it. If you can ask it.
Yeah, she told me to ask it. In places like Barbados, concrete and air conditioners are replacing older wooden homes with natural ventilation. How could a Caribbean-based scientist collaborate with you to study air quality in those homes and support local scientists and architects championing the older designs? And this is also an issue in Africa, other places of the world, that going from traditional like kind of mud design as well to concrete.
Yeah, just briefly, unfortunately, the move from the more traditional housing to a more concrete, westernized building is not a good move, because the more, and just this is all generalization, but the more traditional buildings have much better natural ventilation, much more better leakage. And it is just, I think a healthier way to build a building to provide natural ventilation approaches. Unfortunately, this moving to tight structured buildings with air conditioning, I don't look at that as a great way to go. But I do think that now that we have a lot of low cost sensors for air pollution and air quality available, it's becoming easier to cross partnership with institutions who have such expertise to be able to work with communities and other institutions. I'm working with a group in South America where I'm consulting with them on, here, buy these low-cost sensors and put them in homes, and here's what we'll do with the data, and here's what it will tell us. And I think it's an exciting opportunity to collaborate.
Great. This question came in for Dr. Ramaswamy. Many cities, but anyone can answer it. Many cities in the US have planning and development, but when you look at cities where many AAU universities are located, they are in these cities that continue to have high levels of inequality that change only after gentrification. What's needed to partner in places that have not addressed structural and historic biases that just perpetuate them?
Okay. So what I was going to say is it's going to be very hard for universities or any of us alone to fix structural issues. It's going to also take a very long amount of time. And I know that I've said this many times. This is particularly why I like to partner with cities to institutionalize policy. So any of these plans that we're making, they're plans till 2030, 2040. And the idea is, if we can agree on metrics, I just saw another question on what is resilience. So if we can agree on resilience isn't going back to where you were, which is highly unequal, but how would you go also thrive and have everyone thrive? And so even thinking of what we define, what we measure, and if we can set those in place that can be adapted as data comes along, then you have a long-term agenda. It isn't going to be a quick fix. But I think that, and having conversations that help us even understand what we mean by inequality and equity. There's different definitions, there's different metrics. It's not even, when you're in a room with the communities that are, even having the comfort level, not everyone has the comfort level to have these conversations. So it's going to be a long haul, and it should be a long haul, but having continuous convergent conversations and data and your plans aligned with data, I think would take us forward. In many cities we work with, they have very robust engagement. So even though they are highly inequitable, they also want to change. what their procedures are. And so I've seen a lot of engagement where they're going out to communities to get feedback on plans moving forward.
If I could just add one principle of environmental engineering that I think is really important to discuss in this context, which is the common good. The common good means it's much better for everyone to have healthier water and clean air and access to equitable environmental engineering solutions. The common good does not always happen by people making the right choices in the democratic process. So sometimes we need policies to be changed at the local community level and the government. And so I think working with policymakers and reaching out to local legislatures to say, this is not equitable, we're trying to deal with a common good issue here, we need your participation.
That's a great point. I don't think we think about these things as often as we should as a common good, especially water. Since it's delivered to our house, we think it's our water. We're billed for the water we use, but it is from a shared resource and it's a limited resource. Kind of going with this idea of water, Dr. Walton, I'd like to throw a question to you. Since data has been mentioned a lot, and you did bring it up in your presentation, what kind of data would you like to see that would bridge this divide between, say, at the home tap and what is typically, I would say, monitored in the distribution system or as a regulation? And what should people know who aren't in the field about their water quality as it travels through this network of pipes?
So that's a good question. We keep stumbling into buildings that have unsafe water. 10-year-old buildings, green buildings, pinnacle of an architectural firm's career, and it has, copper levels at 3 milligram per liter. The limit's 1.3, health-based limit for the US EPA. So, the fact of the matter is buildings aren't designed to have safe drinking water in them. They're generally designed to have water delivered at a certain flow rate and pressure to them, and that is to take care of hygiene and sanitation with some chlorine disinfectant or some other thing in it. But really what needs to happen is just a recognition that we don't actually predict water safety at the faucet right now. We deliver water, say, to water meters. That's where it's tested to. And then once it goes in the building, generally it's not tested. And so we just really need to recognize that issue and then also go aggressively at the problem. Recognize that all these 5.6 million commercial buildings exist in the United States. That's a big amount of work if we're going to try to figure out if they're all safe or some of them safe or not. And building owners are going to be scared. Health departments may be scared. I don't want to test. If I test and find Legionella in that building, what am I going to do now? Right? Is it in the other 400 buildings? Am I going to have to oversee 400 buildings of disinfection? It's just a big issue. But if we go into it, I think, with a positive approach and a collaboration of convergent disciplines, I think we can build back better.
And so kind of on that question too, Dr. Beamer, in thinking about exposure and exposure within our buildings or within our environments, what kind of data do you feel is needed in order to really understand it and then also to communicate it? And how would you communicate that kind of data needs to the general population?
Sorry, I was ready for a different question, but can you say that one again? Just really quickly.
Sure. And the same idea of data and needing different data, how, as an exposure scientist or exposure, someone who does with exposure environmental engineering, what kind of data would you want to be seen collected within our environments, within our buildings, within our cities, in order to really understand exposure issues and also to communicate it to the community at large?
Great, thank you. So I think some of the biggest questions that are coming up in our field are how are the behaviors of people changing and how can they change in the workplace and in schools to come back safely? So how can we, how much do we come into interaction with other people? How much do we come within that space? How many people are in different spaces? That's one of the big key areas that people are asking a lot about. And one of the interesting interdisciplinary projects I worked on earlier this summer that led me back to my roots was these contact tracing apps on our phones, right? And those are basically Bluetooth technology. It's keeping track of how close people are to each other and for how long. And that's one of the things that's the hardest things to figure out. I mean, it's easy if you remember the person you spent 15 minutes with within 6 feet, but you don't know everybody who you sat next to on an airplane, or you don't know everybody at the grocery store. And that's where contact tracing using manual methods is a little bit harder. But some of these other technologies could be more useful, but we need more data on how well they work, how well they really relate to what's going on in the real world. You know, it's attenuation between phones. So if it's in your backpack, does that make a difference? And then the last area that has been really interesting is this, work with wastewater and measuring coronavirus in wastewater. And what does that mean? And how can that be used to identify buildings, perhaps, if you do it at the building level, which is relatively new, to focus your mitigation strategies. So we're using it here at our university to focus on different dorms and prioritize dorms. But it's one of those areas with exposure, like if you can figure out where there is exposure, then can you go in and then mitigate things? So there's a lot of different areas, I think, that tie back to exposure and all the things we've talked about. And just not to pick on you, Andrew, but on your slide with all the different disciplines, we weren't there, even though exposure assessment's part of risk assessment, part of epidemiology.
It said and more.
But we don't want to be and more anymore, because we are, this is the thing that we need to do to reduce transmission, is to reduce exposure.
Great. I'll throw a question now to the whole group for whoever wants to answer it. But we have a question that came in from Martha. If infrastructure hasn't been serving everyone well up to this point, does it follow that we don't actually want resilient systems? After a major shock, wouldn't resiliency return us to poor outcomes for the most marginalized?
Let me take that, because I think I had addressed it in my previous question. There are many definitions of resilience. And the older one was what you're alluding, not the older one, I think what people typically assume. Resilience is going back to where you were. And that isn't, so most often we now define resilience as returning systems to their functioning and promoting thriving of everyone. And so it includes not only returning to functioning, but also to promote thriving and for everybody. And that's where the equity piece comes in. I think the challenge with anything, sustainability, resilience, is so many groups define them in so many different ways. Many disciplines have their own dominant definition of resilience. So actually, in my group, we try to avoid it. We just say, look at health and well-being for all, because it keeps it very clear. These are your outcomes. It's health, well-being, and equity. And resilience is a pathway. And that way we don't focus so much on, are you going back, are you going forward, but what are the outcomes people want? So I know that we like to use words like this, but they're so widely and differently defined that it's better. That's why we created the framework, better to think of what are the final outcomes. And if they are health, well-being, justice, economy, then that helps keep your intermediate pathways in line to the final outcome. Thanks.
I would just add quickly that true resilience is a lot deeper concept than just durability. And so I think what we want to avoid is a failure situation that negative impacts lives and health and that type of thing when infrastructure systems fail. I think we had a great example in Puerto Rico, where the energy system there totally collapsed, it was devastating to communities. People couldn't get medicine, children couldn't get formula. So I think we want to avoid those types of scenarios in designing resilient systems, but that doesn't mean systems that don't give way. And in fact, there's a lot of great examples where, for example, in coastal areas, rather than having a lot of investment in coastal infrastructure, having boardwalks and things made out of wood that are designed to be washed away and then easily replaced. So I think there's a lot of depth there in resilience, and it's not quite so much just about sort of, again, durability.
Great. So we have another question here. Are there, and this was specifically for Mr. Kane, but anyone in the group can also answer. Are there any tangible initiatives your institution is or are taking to address diversity in teams, equitable and finance connections with community members, diversifying faculty hires, et cetera?
Yes, so the Envision Sustainable Infrastructure Framework that I mentioned, we specifically call out both equity and social justice and understanding the context of equity within a project, collaboration within in teams and things like that. So yes, we do target that. I would also say, since we work a lot with companies, one angle that we try to stress very much is when you're thinking about equity within and diversity within teams and companies, as I mentioned in my talk, it's not just a check the box exercise. Okay, yes, we're good, we did this. It's a value to the company. It's what you want as a business to have diverse teams. And again, while homogenous teams might solve problems faster because it's easier when everybody talks like you, thinks like you, probably agrees with you, it's the diverse teams that are going to solve those problems better. And that's going to be the advantage that helps engineering firms and organizations going into the future.
Just wanted to add, in the academy, this is really key at the faculty hire stage, like you said, and it needs to embed itself through the whole process, not just at the hire, but also in promotion tenure policies. And it's one of, I think, the things that we're having the hardest things dealing with is changing that system. And it's one faculty member at a time. You have to wait till somebody retires or leaves to get a new line and then think about how to use it. But it's really key to bring it up at the beginning. And to ask questions like, what would you do to promote diversity? What would you do to bring in diverse teams? How does your work engage with diversifying these perspectives? And ask for concrete examples and make that a big priority, not just an afterthought of the search committee or a checkbox that they have to mark.
Great. I think we are out of time. I don't know if Dr. Miller, Dr. Beamer, if you could answer this one super quickly, but one question did come in about Halloween. Should traditional trick-or-treating for Halloween be canceled, not just for concern that kids will pick up COVID from touching shared candy bowls, but potentially contaminated containers will enter the home? So if you could give like the 30-second answer to that.
So I can tell you, I went to the hardware store yesterday and bought a 6-foot-long PVC pipe, and I'm putting it outside my house and I'm tossing candy down it. My kids would be devastated if I didn't do that, and I'm not that concerned about me transmitting COVID by touching a surface. I'm much more worried about, the airborne route.
Agreed. I think, it's just like going to the grocery store and picking up food at the end of the day. But one of the things that we're doing in our neighborhood with our kids is we're doing a parade of their costumes so that they can do that. And then just having already prepackaged little treat bags for them as a way to minimize. I was more concerned about the risk of our elders that really want to interact with the kids and love handing candy out to them than the kids themselves.
Great. Well, this has been an amazing discussion. Just to wrap up, I think that we touched on a lot of topics dealing with equity, resiliency, envisioning the future of cities and infrastructure. And I think the thing that's really resonated with me is just highlighting all the gaps that we have now that we can see our future work and our future research needs to fill and should fill in the coming years. So this has been really great. Thank you all for participating. And I'll hand it back over to Dr. Naughton.
Thank you, Dr. Alfredo, for your great moderating of this session. But thank you to all our panelists, our moderator, to all the students and our administrator that are helping behind the scenes. This is a lot of work to do, but we're happy to do it. Next week is our session 4. I know it'll be a busy week next week. Please, if you're in the United States and are eligible, please make sure you exercise your right to vote. But then on Friday, please join us again for our next session on COVID-19 and sustainably supplying food, water, and energy. Please take the quiz after this session through the QR code, or it's available through our website, so you can earn that certificate if you do all 6 quizzes. And you can still, for each session, gain contact hours for Envision. I'd like to thank our sponsors, National Science Foundation, and others on this slide. And thank you to all our attendees for listening and all of your great questions. We'll try to get them answered and posted on the website, the ones that we couldn't answer today. So thank you again, and I hope you have all a lovely weekend. If you participate in Halloween, have a happy Halloween. Thank you.